We begin by talking about Bill 15. That's the big bill from the Quebec government that would reform healthcare in the province. Now, a new petition was tabled at the National Assembly on Friday by Liberal MNA Jennifer Macaron. She says she's worried that Bill 15 could jeopardize access to healthcare in English. With more on this, let's go to the Liberal Party's official opposition critic for health, and that's André Fortin, the MNA for Pontiac. Monsieur Fortin, welcome back to the program.
Good morning, sir.
So, Bill 15, we all know it's a monster of a bill, right? And in monster bills, things can get lost. Give us the skinny here. What happens to English healthcare in Bill 15?
So there's four articles contained in Bill 15 that pertain directly to access to healthcare for Anglophones, and they're to do with the access committees. So as many of your listeners will have heard over the years, every healthcare establishment across the province that deals with English-speaking patients has these access committees in place in order to see, okay, what type of service are we giving? How are they administered? How are our services geared towards our English-speaking population? And those are typically done by a committee in-house at the various establishments, because what you need in Montreal may be different than what my riding needs in Shawville or they need in Gaspé or other places like that. So what Bill 15 proposes to do is to give Santé Quebec, which is the new healthcare agency, centralized healthcare agency, all of the powers of determining what's in those access committees and who exactly has input into it. And that's to us concerning. Already the bill is taking a lot of independence away from the local healthcare establishments, but to also know that those things will be written, approved by Santé Quebec itself instead of by people in our local healthcare establishments, I think is what has a lot of people worried, and hence why QCGN put forward a position not just on English services, but on Bill 15 as a whole.
Now, Mr. Fortin, you know that English access to healthcare has never been perfect in this province.
No.
You know, we had complaints before, pre-Bill 96, post-Bill 96, and that. What do you think is the most concerning, that makes the greatest case that, once this bill is passed, it could actually get worse? And is it different between Montreal? You mentioned the regions, like being an Anglo in Gaspésie must be much more difficult.
It's already very difficult in some cases to access services. You're right, and sometimes it comes at a time where people are. When it comes to healthcare, you're not always in the best situation, the best disposition to fight for your rights and to advocate for what you need at that point in time. And so what worries us, and I think what worries the people who put the petition forward, is that those committees are really there to act as that watchdog to say, okay, along the way here, we realize that we're having difficulties in this sector to providing constant services in English. We realize that in this region, we may not have this type of specialized service available in English when it should be. So they're an access plan, but they're also a regular review of practices and what's being done. And if that is centralized in a healthcare agency that has a million other priorities, will they actually take the time to do the proper work and to get the community input that's needed in those documents and those plans?
Yeah, so you're the official opposition. Of course, CAQ is a majority government, so they can do it. At the end of the day, they can do what they want. What do you think your party's role is right now to defend access to English healthcare? What can you do?
Well, first of all, making sure people in the community know this is at risk and they have their voice heard, and that's what we're doing with this petition. The other thing is we still haven't studied those articles of the bill. So as you said, it's one of the largest bills that the province has ever seen. There's 1,200 articles. There's 4 articles that pertain directly to services in English. The minister is proposing today, actually came to committee and said, hey, I've got a fast-track idea on how we can study the next bill so that I don't have to invoke closure in 3 weeks. Well, we have a job to do, which is ensuring that we study those in depth, that we make the corrections necessary. And so I understand the minister wants to pass this bill before the semester is over, the session is over. But there's so many things that are still in this bill that we can't simply accept for him to say, we're going to fast track everything that's left. I hope we can, and actually one of our objectives is to get to these before we invoke closure, because then there is no voice after that. So we need to study those bills this week, and that's one of the things we absolutely want to do and want to push the minister on.
With Liberal MNA André Fortin, whenever I talk to someone in healthcare about Christian Dubé, the health minister, their tone kind of changes, and they're like, they begrudgingly admit that he seems to be more open than most ministers to listening. I'd love your thoughts on that. How do you think he's handling this?
I think so. I've spent the last 8 months with the minister studying Bill 15, and he doesn't like confrontation. He is a very agreeable person, but he's agreeable to things on the margins of his bill. The basic principles of his bill, he has not changed. He doesn't want to hear the arguments on the need to reform Santé Québec, and he also doesn't accept the arguments that there are probably a lot more pressing issues than a governance structure right now. Hence, he's agreed to spend the last 8 months in committee looking at it. So, sure, there are things that have changed along the way. Various groups have put pressure on the government to make amendments on the way foundations are administered, on who controls the research establishments. But, 6 premiers came out against this bill, against major parts of this bill, and within minutes, if not, or hours, if not minutes, he'd already said, nope, we're not changing anything on these specific dispositions. So sometimes he is agreeable, sometimes he's not, but on the basic principles of the bill, he hasn't touched much. So let's see what happens on English rights.
Let me ask you, Mr. Fortin, while I still have you. Let me serve you up something nice and juicy, and I'll see what you do with it.
Okay.
Let's talk hockey in Quebec City. Let's talk about the Los Angeles Kings. Eric Girard was getting hammered by the press gallery this morning in Quebec City on the subject. Where do you stand on the $7 million for hockey players in Quebec City?
We don't understand what the government's trying to do here. To us, it seems like a government who's kind of lost its compass since the by-election in Quebec City. The same day they announced this investment, so to speak, in the LA Kings, the front page of La Presse was how there are arenas across the province, local arenas who don't have enough funding, who are at risk of closing. And so to say we're going to use $5 to $7 million of money that is supposed to go to community groups and redirect it to bring 2 preseason games to Quebec City, it just seems like we are taking public money and giving it to people who don't need it. Like the Penguins went to Nova Scotia this spring. They didn't get a cent of public money to go there. They went because they wanted to, and they thought it would put on a great show for the people of Nova Scotia, which it did. So to have a minister like Eric Girard, who is known to be fiscally prudent, 1 week say, listen, we got to tighten our belts, everybody. We don't have enough money. And the next week spend $5 to $7 million for this. It seems counterproductive, counterintuitive, and probably counter to the public good.
All right, one softball for you. You just got it. Let me throw you one curveball to wrap up the interview. Now, listen, the Liberal Party Quebec, you're the party that gave big bucks to build that Centre Videotron in Quebec City.
Yep.
Shouldn't you be the party that say, you know what, let's double down. Let's get more hockey teams in Quebec City. Let's bring baseball back. Shouldn't you actually be, in this instance, the party of big business? Because I always heard the Liberals is the business party. Shouldn't you actually be saying, hey, let's double down, more NHL, more big-time events in this province?
There's an argument to be made that it would be great to have more sports teams across the province. But the context in which we're doing it now, and when I hear the arguments from the government, They really don't make any sense at the moment. CJAD came out and said, we have this great venue in Quebec City. We'd like to see it used more. We'd like to see it packed with people. Where the Quebec Remparts play there, and it's packed a lot of the time. They play with five-figure amounts of people in front of them. So it's not like that venue is unused. And in the same week, you had the CFL say, hey, wouldn't it be great to maybe have a team in Quebec City? You had the NBA publicly muse about going to Montreal. You've got Major League Baseball, who is taking small steps, admittedly, but who keeps Montreal on their radar, and the NHL, who has shown no interest in Quebec City, and that's what we're going after. And we think that by subsidizing two preseason games from a team who really doesn't need our money, that's the way of going about it. Honestly, I think there's better things to do with this money in a time of very fiscal restraints.
Mr. Fortin, take care. Thanks for coming on. Always a pleasure.
All right. See you soon.
That's André Fortin, the Liberal MNA for Pontiac and the official opposition critic on health matters.